Thank you for taking the time to view this presentation. Thanks for all of your hard work and dedication to our community and to our organization. 9/11, do you remember how you felt that day? Did you feel hopeful or helpless? Did you feel powerful or powerless? Did you want to run out to help, or did you want to hide and ignore it? We are going through this tragedy again, but this time it's hitting our institution and our community hard. It's affecting everyone throughout the country. More than 6 million people have applied for unemployment already. We, as physicians, are the lucky 1% that will keep our jobs. We worked hard to get here. It is an honorable profession that we have, one that has much responsibility to go with it. We are looked to as leaders. We are trusted to get us through. We're trusted to care for others and our community. The people we work with every day at Gunderson are what makes our work easier, enjoyable, and more efficient. They are the ones doing the follow-up calls, the wound cares, the ones showing daily compassion to our patients at the bedside or in the clinic. They're the ones taking the biggest financial hit. Many of these people are being forced into furlough, have work time reduced, or being shuffled into other areas to find work. These are the ones living paycheck to paycheck, the ones worried about feeding their families, paying for daycare because the schools are closed. We are all going to feel the financial pain this spring. In order for our institution to survive, our community to thrive, we're going to have to sacrifice. This will be a short time period, one we can endure. In the scheme of our life and our career, this will be a very short period. I want us to be able to look back at this with pride and tell our grandkids about all the great things we did for each other, for our community, and for our institution. What I want from you. Firstly, kindness and caring. How many of us knew that Lauren lost her grandmother last week? This was Lauren's best friend. She was her bridesmaid. Did we give her compassion? Did we reach out and give condolence? Have we talked to our staff and let them know that we care about them? Know that we understand their hardship? Please take time to do this. They are the people that make our job easier. They're the ones that keep Gunderson moving. I know we are doing this already, but I just really want to emphasize the importance. Secondly, let's do our jobs. Leadership is working hard on planning and preparation with this crisis. Stacy and Lauren are doing 12+ hour days. We need to trust in them. Trust that they are doing their best with what we have. We have never been in this situation before. There's no owner's manual for this. It won't be perfect, but as leaders, we need to trust their judgment and decisions. Don't be critical or judgmental. We don't know everything they know. We've not been to all the meetings, heard all the sides. As leaders, as physicians, we must do our jobs well and trust others are doing the same. Thirdly, it's time to prepare for the reopen. We're not sure when this is going to come. Leadership is working on what criteria we need, be it adequate testing, perhaps vaccination or other therapies, adequate PPE. We're still trying to determine this. Use this time to make a plan for the reopen. Work with your teams to form a plan. I will be reaching out to all of you to help facilitate this. It will need much foresight and planning. And fourth, let's reinvent ourselves. What can we do differently in the future? What can be done better, more efficiently? Truly take practice and clinical variation to heart. Work on this during this downtime. Fifth, let's donate. The foundation has established a fund to help our people in this time of need. We're the 1% that can afford to give back. They're the ones in need, the ones in crisis. Dr. Shapiro has sent out the foundation information for you to do this. Just follow that link. Finally, we will get through this together. Gunderson and our community will thrive. We will all be stronger as a result. Our practices and patient care will be better if we take this time and work to reinvent ourselves. We need to be leaders, be kind, be caring. Trust our leadership and support their decisions. Please give what you can to support all of our staff. They're the ones hurting the most. They're the ones most in need. These are the April showers that we must endure. We must get through it so we can reinvent ourselves, become more efficient, and serve our community even better. We will have a department meeting next Tuesday where we can further have discussions on this. I would like to make a point to have phone or video conferencing weekly so that we can all keep in touch. We will continue to move forward with planning to open. Thanks for everything you're doing. Mayflowers will come.